Chapter 5 Social Cultural Influences Topic 5.4 Ethical Conduct by Performance. Our learning objective for this topic to understand what is ethic, sportsmanship, gamesmanship, and contract to compete, and also to identify performance-enhancing drugs and its advantages and disadvantages. This is the key terms you must know. Number 1. Ethic. Its unwritten rule in an activity. It is not an enforceable rule, but it is usually observed. Sportsmanship. Conforming to the rules, spirit, and ethic of sport. Gamesmanship. Its attempt to gain an advantage by stretching the rules to their limit. And the last one, contract to compete. Its unwritten rule agreement between opponents to follow and abide by the written and unwritten rules of the sports. Okay, what is performance-enhancing drugs? It is chemical substances that's introduced into the body and also can affect a performer's ability and may give them unfair advantage when competing in any tournament. Performance-enhancing drugs can be divided into three groups. Group 1, substances are prohibited, such as stimulants, narcotic analgesics, anabolic agents, peptide hormones, and diuretics. The second group, methods that are prohibited, such as blood doping. And the third group is legally prescribed drugs whose use by sports performers is restricted, such as Betablockers. Okay, let's go to advantages and disadvantages. Number 1, stimulant. So each advantage will affect on nervous system, increasing mental and physical alertness. For example, cyclists in a long distance. And what is the advantage? Will increase risk of headache, blood pressure, stroke, and irregular heartbeat. Narcotic analgesic. Its advantages is will reduce sensation of the central nervous system, so help pain relief. For example, footballer taking painkiller to get pain relief from injuries. And also this narcotic analgesic, also known as painkillers. What is disadvantages? Respiratory depression can be addictive, will increase risk of constipation and apathy. The next one is anabolic agent. It will promote muscle and bone growth and also will get strength, muscular endurance, and power, and most commonly abused drug in sport, and also known as anabolic steroid. What is the disadvantage? It will increase the risk of liver cancer disease, hair loss, high blood, and also heart attack. Peptide hormones. It is also known as erythropoietin (EPO) and also known as anabolic steroid. For its advantage, it will increase blood cell count and also aerobic capacity. And this drug usually will use in marathon and cross-country competition. What is the disadvantages for this drug? It will increase the risk of heart attack, blood vessel to block, stroke, and blood thickness. The next one is diuretic drugs. It will remove fluid from body by increase the rate of urination and also to lose weight quickly, and also will reduce concentration of prohibited substances. So example of sport for these drugs, boxing and martial arts. Disadvantage for this drug, it will increase the risk of dehydration, kidney failure, heart failure, and also muscle cramp. Next one is blood doping. This blood doping is one of the methods the athletes use for their own. What is advantages for them? It will increase of red blood cells in bloodstreams, also will improve aerobic capacity, and the athletes will recovery time shorter. And example for these drugs, they will take this drug such as in the marathon and cross-country competition. What is the advantage for this drug? It will increase of blood thickness, heart attack, stroke, and also infection. And the last one, beta blockers. It will reduce heart rate and also reduce muscle tension and blood pressure. And this drug also will improve fine motor control and preciseness. So athletes will usually use this drug in archery and shooting competition. And also there's a side effect of these drugs. The athlete will become nausea, heatiness and weakness become high, and increased risk of heart problem.